Alrighty. Good morning, good morning, good morning, good morning. I am Dr. Joy Fremont, Miss Dr. Lady, as I am known in these streets. Coming to you live from Hateville, Georgia, 404-761-1659. Yes, I'm a dentist. Yes, I've been one for 24 years. And I'm still here. Boom. But today I'm coming to you this morning, to talk about oral cancer. Oral cancer. I know it's not a fun thing to talk about, but most stuff about dentistry is not. So get with it. So oral cancer is not as uncommon as you think. You know, we talk about breast cancer, prostate cancer, and all of those things are deadly, and we don't like any of them with the C word. But oral cancer is something that I look for every day in my patients. And hopefully, if you are not a patient of mine, your dentist is checking as well. And most people think that if you have cancer of the mouth, you get it from smoking or drinking heavily. While that is true, that is not the only way that someone can develop oral cancer. And oral cancer is becoming more and more prevalent in our younger patients, so like our teenagers. And what we find is that the HPV, that's the human papillomavirus. Long word, just say HPV. What is happening, Joseph Weatherspoon? HPV is very prevalent amongst our young people, our teens. And why? It's not because they're smoking or drinking. It's because they're becoming more and more sexually active. Come on, parents, let's get with it. But I'm not here talking about that. I'm not talking about your child having sex. I'm talking about the HPV, okay? HPV is one of the common denominators in our young people who are getting oral cancer. So I'm going to be real quick with you. Even if you're not a teenager, you can get it, okay? So if you, of course, are a smoker, if you smoke cigarettes or other stuff, let me go ahead and get with y'all real quick. You all think that because you don't smoke cigarettes is not a big deal. Anything that is heated that goes into your mouth can cause cellular damage. That means cigarettes. That means cigars, even once in a while. That means the hookah. That means the e-cigarettes. If it is hot and it heats up your mouth, it can cause a cellular change. Doc, I don't smoke cigarettes. I just smoke marijuana. I'm not judging you. I'm just telling you. Yes, that can cause it too. All right, but I'm going to move on. I'm talking about oral cancer. So what I want you to do is to do a self-check. Just like we ask our ladies to do a self-check exam on your breasts for breast cancer, we ask our men to get the prostate checked. You can't really do a self-prostate check. Or could you? That's a midnight discussion. But anyway, do your oral cancer exam. Pull your lip down. Pull your cheeks out. Get up in there and look. If you see anything that's not normal, that you know, like if you know you didn't bite your tongue, you know you didn't bite your cheek, you know you didn't burn your mouth with hot coffee or a pizza burn. If something is abnormal, bring it to my attention. You know, don't wait until your next checkup. Call me immediately and say, hey, doc, you know, something's in my mouth, especially if it's been there for a long period of time and it's not going away. All right. If you see any bumps, lumps, cuts, patches, like red, white, gray, or black, that is not normal. Okay. And don't rely on Dr. Google to fix it for you. Okay. Come in. Let us check it out, because whatever we can find early is a better option for you. Okay. And some things, guys, I can't even see with my naked eye. So we have, voila, the Velscope. Okay. Velscope is one of a few oral cancer detecting devices that we use as a dentist, okay? And I don't know if you can see it, because I don't know if you can see this light. You hear the sound, right? This is a Velscope cancer detecting unit that we use on our patients to help us see precancerous or even cancerous cells below the tissue that I can't see with my special magnifying glasses, okay? And we use that on our patients just to make sure we're not missing anything. It helps me see better, help me treat you better, and catch things earlier versus just coming and looking really quickly. I do, however, do oral cancer screening on all of our patients at each of their checkups, meaning their cleanings. Of course, I'm in your mouth. when I do a filling, but I'm not checking for that at that time unless you ask for the Velscope. So when you come to our office, ask for the Velscope. We'll be happy to do that for you. If your dentist does not offer the Velscope, maybe they offer something different. There are different things out there, but by all means, make sure if you're not coming to Dr. Fremont, whoever you're going to, make sure that when you have your checkups, they're pulling the lip down, pulling the cheeks out, having you stick out your tongue, look at the roof of your mouth, the base of your tongue, the floor of your mouth, back up in the throat, right? That's our area of expertise. And so although you think we only do fillings and cleanings and pullings and root canals, we do check for oral cancer. And by doing that, it can save your life, all right? So once again, boom, just a quick see. Once again, check yourself every single day, at least once a week. Look up in there when you're brushing your teeth, all right? Something abnormal, let me know. If you're having a hard time swallowing, talking, chewing, let me know. Those things can be fixed, hopefully. Let's save lives, all right? So I'm Dr. Joy Fremont, 404-761-1659. Give me a call if it's time for your oral cancer screening, or if it's not time and you just want one. All right? Holla at you. Have a great day. Bye-bye.